Hello, my name is Dr. Mary Van. I am the clinical director here at ThriveX. We are an infusion and wellness center that focuses on functional medicine, and our specialty here is infusion therapy. And by infusion therapy, I literally mean that we place an IV line directly into your vein, and via that IV line, we infuse your body with minerals, amino acids, vitamins, and the occasional herbals like green tea, resveratrol, and turmeric. And most of our patients coming to our office, I'd probably say the majority of our patients are on some form of IV therapy, either for prevention or to support them through certain periods of time. For example, cancer therapy, Alzheimer's, osteoporosis. A very common IV that we do actually is sleep IV, and occasionally we do some aesthetic IVs as well. For example, the most popular IV at our clinic for aesthetic purposes is one called the Cinderella IV, and the Cinderella IV is intended to even out skin tone. So it really runs the gamut in terms of what we can do with IV therapy, in terms of the very serious conditions of supporting somebody with cancer, to our super athletes, our triathletes, and other types of extreme sport activities that need prevention and also need help with endurance. So a common question that the family members and their family physicians will often ask us is, why IV? Why don't you just give them their nutrients orally? Well, the reason we utilize IV therapy is for a multitude of reasons. Number one, I don't have to worry about something called bioavailability. Bioavailability is actually a pharmacy term. And what it means is, bio means life, and available is how much of that vitamins, nutrients, or anything that you take orally will reach you at the point of life, which for us is our blood. So how much of something that you intake will actually reach your bloodstreams. For example, my kids, that's an example I give very often. I have a 5-year-old and a 6-year-old. Nothing has ever happened to their gastrointestinal tract. They are very, very healthy. But as healthy as they are, if I give them a vitamin, I know that their digestive system can only intake about 30%, if they're lucky. Now, by the time you reach my age, and I've been through a little bit more from a gastrointestinal standpoint, my ability to absorb is probably down to 15 to 20%. By the time you reach my mother's age, who's in her 70s, you're talking about a absorption rate of probably less than 5%. So if you imagine all those vitamins you take orally, about anywhere between 70 to 90% of it is actually going to be thrown away because your body simply could not absorb it. With IV therapy, the beauty of it is the nutrients are going literally directly into your blood vessels. So I know that you are getting 100%, and not a single portion of that is wasted. Number two, because of its high bioavailability, I'm able to utilize a pure product by itself. There are no fillers, there are no preservatives in there, because the fact that it's going directly into your veins. There's no need to try to preserve it, so there's no need for fillers. So I know what you're getting is only what I want you to get. I don't have to worry about any GMOs or anything like that. It is what it is in its most natural form. And number three, because I can give it to you intravenously, I can give you really, really high doses. For example, one of the most common IVs that we give in our office is actually high doses of vitamin C. At a base high dose is about 25,000 milligrams, or 25 grams. If you were to attempt to take 25,000 milligrams in one ingestion, because vitamin C is an acid, you would vomit. There's very little chance that you would actually be able to hold in that amount, because your digestive tract just could not tolerate that amount of acid. However, intravenously, I can place 25,000 milligrams directly into your veins, which we buffer, and your body is able to not just absorb 100% of it, but get a much higher dose so that I can create a much faster metabolic change in your body. So those are the primary reasons that we utilize intravenous therapy. Now, returning back to questions that family members and physicians have, why not just give it to them orally, isn't taking it orally more natural? Well, the challenge I give to those are, what if I could convince you that taking things orally is actually quite unnatural, and that intravenous therapy is actually a much more natural way of getting nutrients? And usually it's other physicians and other healthcare providers that give me that challenge, and so I challenge them back. And I says, what if I can prove to you that IV therapy is the more natural therapy? And so usually they say, okay, well, fine, go ahead, prove it to me. And so at that point I say, well, do you have a belly button? And of course we all have belly buttons. And so I say, please differentiate for me the difference between an umbilical cord and an IV cord. And there really isn't much of a difference. Because if you think about it, when all of us, like each and every single one of us, was in the womb, how we received our nutrients, every ounce of calorie, every ounce of nutrients was received directly via the bloodstream. And if we return back to the fact that every single ounce of nutrients we were able to create was via that umbilical cord, that is the same power that IV therapy has, because the umbilical cord is able to send and sustain enough nutrients that in 9 months it can create human life. And we say the same thing for IV therapy. It is nutrients so powerful that we can change you metabolically and help you prevent, help support you, and create wellness via that IV line. So that's why we do IV therapy, and why we are such huge proponents of all of our patients receiving this type of therapy. If you would like to learn more, please subscribe and like our YouTube channel, and please leave a comment about any other topics you would like to learn about, and we will try to respond to as many as we can, or any other type of feedback. Thank you very much.